ठीक है. Hi friends, we today come to another class on occupational diseases, and this let me put it this way: lead poisoning is not very common in our country today, but lead poisoning is very common in your community medicine paper. So let's put it this way: it's very, very important. It comes almost every alternate years, a short note, it keeps coming. So read up about this. You may not see a lead poisoning case ever in your career, but you'll definitely see it in your examination paper. So let's study about lead poisoning. Lead is a bluish gray metallic element which occurs naturally in small amounts in the Earth's crust. It's dense, hence its use as a ballast. You'll know what's a ballast. Ballast is basically something which is kept for keeping things stable. Ballast, keeping ships, basically you use ballast for keeping stability of the ship or keeping that making it float. Ammunition or radiation shield. Lead is insoluble in water, but some salts are soluble. In the medical industry, where is lead used? In medicine, we use lead mainly as a protective against X-rays. So, for example, when we are working in radiology department, we have those aprons. The aprons are lead lined. We have got the doors which are lead lined. We have the screens which are lead lined. So radiographers and radiologists definitely utilize a lot. They come in contact with a lot of lead items, though they may not be coming physically in contact because they are kept. The lead is itself kept in between layers of other substances. Well, one thing about lead is something which brings a shine. So lead is something which is has been used since long in pottery, for the glaze of pottery. And Hippocrates in 370 BC also told about lead colic. Ramazani mentioned about tremors. And so it has always been considered. Sir Thomas Legge was the first inspector of factories, medical inspector of factories, and he said if you stop inhalation you will stop the poisoning. We'll talk about it. So there are three lead sources basically: galena, cerussite and anglesite. Galena is lead sulfide found with sulfides of silver, bismuth, arsenic and cadmium. Cerussite is lead carbonate and anglesite is lead sulfate. So these are the three ores which you can get, three different types of ores which you can get: galena, cerussite and anglesite. Now I said lead which is there produces a glaze, produces a shine. So wherever you want to glaze, whether you want pottery, whether you want it in glasses, the good glasses, crystal glasses, they always have lead in them. Whether you want it in paints, you want to shine on your paint. So lead in paints is present in large number of places, and though it has been banned in India also, but it continues to be available. In automobiles, you have tetraethyl lead was introduced in 1923 as a means of stopping knocking of the engine. So its emissions were producing all the problems, and this has also been banned now. India has stopped using tetraethyl lead. So where do we use lead? Lead is used in the metal as a metal. It is used in shielding, and as I mentioned, one of them the radiologists use it. Otherwise, also used in dents in cars, shipbuilding, trucks. Or you got lead shots. Any place to be dent to be filled up, you use lead. That's very easy to use. Inorganic lead, lead and antimony, you use in batteries, in ammunition, and in ornaments. And lead, antimony, and zinc, a combination of these, you use for soldering. Then you have lead oxide, which is called litharge, which is used in electric accumulators. Or red lead, which is used in paints, glass, enamel, pottery, ceramics. Wherever you want to glaze, you're using red lead. Red lead. So this is, if you really look at it, lead is everywhere. Storage batteries. Nowadays, the cables which are coming, many of the cables have got lead in them. Radiation shielding, galvanizing, annealing, plating, paint, soldering, glass, insecticides. Automobile radiators, brass and bronze protection, construction industry, ammunition, printing, plastics, television electronics, and petroleum. Everywhere you have got lead. Also, we must mention this because Ayurveda is coming back in the bang. And in a lot of Ayurvedic and Chinese medicines, you have lead being used. Lead, mercury, thallium, arsenic. It's not that in allopathy we used to use mercury also, if you remember. The mercury was used for treatment of syphilis. They used to say 7 minutes with Venus and a lifetime with Mercury. That was the quotation which was there. Okay. So 40% of the Ayurvedic medicines which are there contain heavy metals. And these heavy metals accumulate. One of the heavy metals which is used is lead. Various other heavy metals are there. So anytime that you get a patient from an Ayurvedic physician who's having problems, please look at metals being accumulated in the body. And these can result in a large number of chronic disorders. Many of the metals get deposited in the liver and you have lots of problems. But in case of lead, it can cause various other problems. Lead paint basically is a pigment, and it is used basically because of the fact that it sticks well and dries up fast. It is weather resistant and it gives a shine, and the colors are very good. Two types: white lead, that is basic lead carbonate, and red lead, which is lead oxide. So we did have a lot of lead things, and lead was used lead was present in various paints and furniture and toys. At present, also large number of toys which come from China have got lead in them. So be very careful, especially when you get a pediatric age of child who comes in and they say that we have not seen the child eating anything, not eating any paint, etc. It could be the toy. The toy may be leaching lead, and that may be one of the reason for the colic that the child is having. So lead exposure from paint occurs very commonly because stripping of the paint takes place, flaking, and then some children tend to eat that pica, that is. Contamination of carpets, curtains, dust can result. And the best mode of lead getting into the body is the respiratory route. So breathing in dust that contains lead, and lead is absorbed to other parts of the body via the bloodstream, and the absorption through the respiratory system is 50 to 70%. Please note that 50 to 70%. While ingestion, the absorption in adults is just 6 to 10%. 6 to 10%. Fasting adult may have a little bit more. In children, the absorption takes place a little bit more, especially in those who are malnourished. And increased absorption takes place if there is less iron or calcium. So children, the absorption of 30 to 50% has been noted. but in adults it's just 6 to 10% in ingestion. Lead in water, basically it is again ingestion. So ingestion, you have got old lead pipes, solderings, fittings, contamination from ground lead, so that these things can occur. 20 to 30% of homes, you find that they exceed this limit whenever they're using these old pipes. And WHO maximum water lead content should be 10 micrograms per liter. Now, absorption through the skin, this is very, very minimal. It is relatively impervious to lead oxides or lead salts. Some may get through if there is a wound or a scrape. Otherwise, it should generally not enter the body through the skin. Lead is absorbed into the bloodstream rapidly, and it then travels through soft tissues like kidneys, lungs, brain, spleen, muscles, and heart. For it to go into body stores, that is the teeth or the hair and bones, it takes a lot of time, it takes weeks. Remember, it goes in, it takes weeks, and for coming out also, it will take a very, very long time. About 94% of adults' total lead burden is in bones and teeth, and in children, it's about 73%. Lead in bone and teeth equilibrate over time. So once the lead in the system decreases, it will leach lead out from the bone into the bloodstream. So how does it come out? Kidneys is 90%. So urine, from the urine it will come out 90%. And 10% is biliary, which the maximum excretion is about 3.5 micrograms per kg per day. So if there is more than 3.5 micrograms per kg consumption, then accumulation will occur. So in the from the bowels, stools, there's a little less excretion which is there. In sweat glands, breast milk, little, very little. The turnover from hairs, nails, and teeth is also very slow. It takes more than 10 years to turn over 1/2 of the body's stored lead. So just imagine, 10 years it takes to turn over. Bone source slowly leaches into the blood. So if you look at how long it takes, the T-half for 30 to 40 days for blood, liver, and kidney is 30 to 40 days, and T-half for as far as that means once the threshold, half of it comes off, it takes 10 to 20 years in case of the skeletal pool. What does it do? The basic problem with lead is it inhibits certain types of enzymes, particularly enzymes dependent on sulfur-hydryl groups. So the sulfur-hydryl group enzymes are the ones which are going to create a lot of things, a lot of problems which are there, and most of the problems which we can think of which take place with lead are from the neurologic, reproductive, endocrine, musculoskeletal, GI, and renal. Let's go through many of them. So first thing is that it will cause microcytic anemia, and this microcytic anemia is accompanied with a basophilic stippling. When you see a film, you will find basophilic stippling, which is there, very classical of lead. Okay, this is a slide which will give you a comprehensive thing as to what is the problems which are going to take place. In the GI tract, you have got lead colic, abdominal pain which can occur, constipation, weight loss, loss of appetite, vomiting. So this, and the load, it depends on the load from 400 to 1000 micrograms per liter. So the most common symptom which person comes with is abdominal pain and constipation. In the blood, you have, as I mentioned, there is a microcytic anemia, and there is stippling which takes place. Subclinical inhibition of the RBC enzymes are there. That's why you have got the anemia. Central nervous system, there's a huge amount of things which can take place. For children, it may affect the IQ, And otherwise, because of the central nervous system affection, there may be mild fatigue, irritability, slowed motor neuron conduction for the lower levels. Then further, when you further go for more concentration, then you have peripheral neuropathy, delirium, ataxia, fits, coma, basically an encephalopathy. And you can have various other things. I will just talk about it in the next slide. There are other things which can take place: muscle pain, hypertension, nephrotoxicity, lowered vitamin D metabolism. So all these things can take place. The other physical findings which are there are a wrist drop, a loss of distal sensation, loss of proprioception, and loss of vibration sense. And chronic is you can have transverse nail lines and blue-black gum lines. Typical blue-black gum lines which are there. Also, the typical transverse nail lines which can be seen in nails. And the peripheral neuropathy, which will let palsy, as we said, we mentioned that there is a wrist drop, there is a foot pain, joint pain, and decreased dexterity. And all this is due to distal symmetric axonal polyneuropathy. So, as far as the central nervous system is concerned, you can have features from irritability to ataxia to hearing loss, impaired judgment, hallucinations, and depression, seizure, memory loss, loss of dexterity, loss of cognition, and death. So these are all the symptoms which are possible in central nervous system problems in adults. As far as the cognitive performance of children is concerned, you may have a psychomotor performance problem, auditory and language processing, sustained attention and concentration may not be possible, less likely to graduate from high school and more likely to be convicted of felonies. In utero also the similar problems which are there, lead crosses the placental barrier and pregnancy causes lead to release from bone stores into the plasma. Plasma lead is about 1% of circulating blood lead, and epidemiological effects on central nervous system has been documented. Peak transfer takes place in 12 to 14 weeks. So what can happen? In cases of high dose, you have spontaneous abortion or stillbirth. And in lower doses, you may have low birth weight. In higher doses, you may have neuropsychological problems. And in lower doses, you may have an additional risk from breast milk, which can also carry the lead. Other problems are miscarriage, stillbirth, inability to conceive, decreased libido in males, decreased fecundity, sperm abnormalities like counts and abnormal forms. That's the reason why there is sterility. Dose-response relationship may be there. Also, the other diseases which combination of diseases, there is lead nephropathy, which is Fanconi syndrome, which is characterized by amino acid uria, glycosuria, phosphaturia, and phosphatemia, and decreased uric acid excretion. And chronic kidney disease may also arise, sometimes associated with gout. Other organs which will be involved are the eighth nerve damage, gout, GI resulting in anorexia and colic, endocrine problems like vitamin D metabolism, and genotoxicity. So everything across the line is possible. Basically, most important is identify and remove from source. Most important is to remove from source and treat the coexisting iron deficiency, iron and calcium deficiency. And then you can consider chelation. So things which are used are EDTA and DMSA, which are standard things which are there. IV for severe toxicity, particularly encephalopathy, you have to give EDTA. It's well tolerated, less than 1% nephrotoxicity. And then 2,3 dimer captosuccinic acid, which is there, the oral agent of choice for lead poisoning, given as a 19-day course, is well tolerated. Main problem is the foul taste and smell which leaves in the mouth. So you can, based on various levels which are there in the blood, you can think of removing the person from the source, or and keep checking whether the person has got more of what's the levels. If it is a little higher level, then check frequently, 1 to 2 months. Otherwise, you check it 3 to 6 months. It's once the level is above 450, then you think of doing a chelation. And for that you can use DMSA chelation, the 1050 milligram per meter square into 7 days, or 700 meters per meter square into 14 to 19 days. If the levels are higher, then you might add ETTA. The key to treatment of lead poisoning is removal from source, removal from exposure, and oral chelation. Oral chelation cannot be a substitute for workplace hygiene. Very, very important. So we have the Factories Act. In the Factories Act, we got exposure levels which are mentioned as hazardous industries. In the hazardous industries portion which is there, we have mentioned 0.15 milligram per meter cube, and short-term exposure limit 15 minutes is 0.45 milligrams per meter cube. So if you're going into a tank which has got a lead exposure which is there, that's only for 15 minutes, that is 45 milligrams per meter cube. While otherwise in the factory area you can permit it is only 0.15 milligram per meter cube. So you must be very careful. Above these limits, you must ensure that people wear not only masks, but they can have one of the respirators. So what will you do in the factory? In the factory, it's very, very important that we substitute this process. Try to use another process which does not have these factors which are. Or you can do an engineering method. So what is the engineering method? You'll use exhaust ventilation, you'll do local exhaust ventilation, you will do isolation. So all these things can possibly be done for the particular process. Personal protection, very important. You must ensure that people wear masks, or have you use respirators, or put gloves and cover the eyes also. Work practices should be good. We must ensure that we do not leave any dust. Basically, it is from dust that we get the lead poisoning. No dust is left, and these should be vacuumed and taken off. Job placement should be good, and we should ensure that there's a rotation policy. In the home, you might like to move out if there is lead poisoning, because you don't know from where it is taking place. You identify the place and then ensure that it doesn't take place from that source. Okay, that's all that I have for today. Very short lecture, and I hope you will read up about lead poisoning. Please remember, lead poisoning is very, very important from the point of view